My Healthcare Reform Comparative Health Systems project encompasses Denmark and Ireland. The countries of Denmark and Ireland are members of the European Union, the EU. In the 8th and 9th centuries, Danish and Norwegian Vikings crossed the North Atlantic Ocean and invaded Ireland, adding their DNA to the Irish genome. The combination of shared genetics and similar lifestyles contribute to the comparable healthcare needs of the two nations. The demographics of Denmark. The population in Denmark in 2024 was about 6 million people. The Danish sovereignty includes Greenland and the Faroe Islands. Although they're autonomous countries and do not count in the population, they are included in health and governmental systems. It's similar to the United Kingdom. The life expectancy in Denmark is 81.5 years, and its ethnic groups are 86.3% Danish. Other groups, making 12.6% of the population, are Polish, Syrian, Turkish, German, Iraqi, Lebanese, Pakistani, Bosnian, Somalian, Chinese, and Romanian. The Danish health system is controlled at several levels. The national level takes lead in regulation, supervision, and quality monitoring. The regional level is responsible for detailed planning and delivering health services within hospitals. The municipal level has the responsibility of health promotion, school programs, disease prevention, rehabilitation, home care, and non-specialized long-term care. According to the World Health Organization, Denmark's total health GDP was 10.8% in 2021. Denmark spends the equivalent of $6,280 US per person on healthcare, more than the OECD average. More than 40% of all deaths in Denmark can be linked to behavioral risk factors, including tobacco smoking, unhealthy diets, alcohol consumption, and low physical activity. Nearly 1 in 3 adults in Denmark report having a chronic condition. Cancer is estimated to contribute to more than 1/4 of all deaths, a much higher rate than the OECD average. Despite having a well-funded healthcare system, the World Health Organization determined that life expectancy in Denmark is relatively low. This is Tonsberg Nursing Home. It is a memory care village outside Copenhagen. Residents are free to navigate the village that includes a public garden, a market, a library, a doctor's office, and a clothing store. Store commodities are free of charge to residents. Conceptually, residents preserve their autonomy through activities of daily living. The demographics of Ireland. In 2022, the population of Ireland was approximately 5.15 million. Life expectancy was 79.6 years for men, and for women, it was 83.4 years. Ethnic groups. 84% of the population consider themselves Irish, while 12% consider themselves non-Irish, being of Eastern and Western European descent, Indian, Arabic, or South America, while 3% claimed no ethnicity. Ireland's National Health Service is primarily funded through general taxation. Public and private services are also available to residents. Private health services are provided through private health insurance plans, commonly as a fringe benefit by employers. The Department of Health provides policy direction, performance oversight, and is responsible for allocating the health budget. As a division of the Department of Health, the Health Service Executive, or the HSE, is responsible for managing and delivering health and social care services. Public health services are generally free of charge and provided directly from the HSE. In most cases, the HSE acts as both a purchaser and provider of services, using its network of hospitals and community health organizations. Occasionally, fees do occur, but they're most common when the HSE must fund other organizations to administer the health care. In 2019, over 35% of all deaths in Ireland were attributed to behavioral risk factors, including tobacco smoking, dietary risk, alcohol consumption, and low physical activity. In 2022, 2.6% of the population experienced unmet medical care needs due to excessive cost, travel times, or waiting times in compared to other EU nations. The shortage of inpatient beds is likely a key contributor to recent overcrowding in public hospitals, according to a study by the Economic and Social Research Institute of Ireland. And despite notable increases of the numbers of doctors and nurses over the last 5 years, healthcare workforce shortages continue to pose a challenge in Ireland. Long-term residential care, LTRC, is a central component of the Irish health system for older adults and the disabled. Of those living in LTRCs, 94% were adults over the age of 65 years. The Irish system for facility-based care operates similar to the US. The Nursing Home Support Scheme, NHSS, is also known as the Fair Deal. It's a plan in which the cost of nursing home care is managed through the HSE, paying either full or part of the cost. It breaks down into some side-by-side comparisons. In 2022, Ireland had the 9th and Denmark had the 11th highest gross domestic product in the European Union. The nation of Ireland will face healthcare workforce shortages by 2050, whereas the Danish reported that they had a comprehensive package that's already been put in place to increase their number of nurses being trained and retain the nurses that are already working today. Another comparison is Irish alcohol consumption has dropped by 32%, and in Denmark it has dropped 27%. But consumption in both countries is higher than the OECD average. This chart illustrates private versus public health care in both nations. These are the population age pyramids. Life expectancy has increased for both nations in the last 50 years. The World Health Organization released that the average age of an Irish person was 83.4 years old. And statistics have reported that the average age of a Dane was 82.1 years. As noted on the chart, Irishmen started lower, but gained 3 more years of life expectancy when compared. Irish women lived on average of 69 years in 1954, compared to 83.4 years in 2024. Danish women lived 72.9 years in 1954, and now live to 83.4 years. Like the men, Irish women gained nearly 4 years of life expectancy when compared to Danish women in the last half century. These statistics were reported to the World Health Organization in 2023. Both countries have the same 5 leading causes of death, all of which have been associated with smoking. The results of this chart were reported in 2023 by the State of Health in the EU, but the data reflects 2021. Ireland allocates nearly a third of its healthcare budget to inpatient care. As for Denmark, its leading healthcare expenditure is outpatient and long-term care services. This graphic illustrates preventable and treatable causes of mortality within the European Union. In consideration of long-term and nursing care, Denmark and Ireland rated below the EU and OECD average for long-term care beds available in 2021. In summary, the takeaways I had from this project were: in 2023, Ireland spent in US dollars about $4,673. Denmark spent $6,280, as where the United States spent $10,800 per person on healthcare. And in 2024, Denmark is the second happiest country in the world. Ireland is in the 17th, and the United States fell outside of the top 20, ranking at 23rd. That being said, I'm going to leave you some beautiful pictures of Sally Cap and the Wicklow Mountains, the Cliffs of Moher, both located in Ireland, and the Monclint Chalk Cliffs, and the Northern Bornholm. These are islands both located in Denmark. Thank you for your time. The references are listed on the next two slides.